Rising childhood obesity rates directly correlate with increasing pediatric kidney stones, and the connection is mechanistic, not coincidental. Multiple metabolic pathways link obesity to stone formation, creating what amounts to a perfect biochemical environment for crystals to form and grow in children's kidneys. Let me explain the mechanistic links clearly. Obesity causes insulin resistance, which affects how kidneys handle calcium and uric acid. In insulin-resistant states, kidneys excrete less citrate, which normally inhibits stone formation, so stones form more easily. Metabolic syndrome creates acidic urine that favors uric acid stone formation specifically. Obesity-related inflammation affects overall kidney function in ways that promote lithogenesis, the formation of stones. The relationship is bidirectional, which complicates both understanding and treatment. Unhealthy dietary patterns cause both obesity and kidney stones through overlapping mechanisms: high sugar and sodium intake, excessive animal protein, insufficient hydration. Sedentary lifestyle contributes to both conditions. Some medications used to treat severe obesity can themselves affect stone risk, requiring careful monitoring. Specific metabolic abnormalities in obese children drive stone formation. Hyperinsulinemia reduces urinary citrate excretion. Citrate normally keeps calcium dissolved rather than crystallizing. Increased leptin from adipose tissue affects calcium metabolism in complex ways. We're learning that adipose tissue functions as an endocrine organ, secreting hormones that influence kidney function and stone formation risk. Integrated treatment approaches address both conditions simultaneously. Lifestyle modifications that reduce obesity, improved diet, increased physical activity, better sleep, also reduce kidney stone risk through multiple pathways. For severely obese adolescents, bariatric surgery is sometimes considered, though I must note that rapid weight loss and certain surgical procedures can paradoxically increase stone risk in the short term. The focus should be realistic, sustainable dietary changes rather than fad diets that may cause other problems. The psychological dimension cannot be ignored. Weight stigma affects treatment engagement. Adolescents who feel judged or shamed are less likely to participate actively in lifestyle interventions. Body image concerns in stone-forming obese children compound their health challenges. Holistic approaches addressing both the physical conditions and the psychosocial aspects work better than purely medical interventions. Prevention must begin early. Early childhood nutrition establishes patterns that persist into adulthood. Preventing obesity in the first place prevents both the metabolic syndrome and kidney stones that often accompany it. School-based interventions can reach children during critical developmental periods. Policy changes addressing the obesogenic environment, sugar taxes, improved school meal standards, safe places for physical activity would benefit both obesity prevention and kidney stone prevention simultaneously. The public health implications are sobering. As childhood obesity rates have climbed over recent decades, pediatric kidney stone rates have climbed in parallel. This isn't coincidence, it's cause and effect playing out at the population level. Individual interventions help individual children, but we also need systemic changes addressing the food environment, physical activity opportunities, and socioeconomic factors that drive both epidemics. For families dealing with both obesity and kidney stones in a child, the good news is that interventions targeting one condition often benefit the other. Improved diet, increased activity, better hydration, and sustainable healthy lifestyle changes address the root metabolic dysfunction driving both problems. This requires patience, support, and often professional guidance from pediatricians, dietitians, and sometimes mental health providers. But it's achievable, and the benefits extend far beyond just kidney stone prevention to overall health and well-being.